Welcome to Community Connections, brought to you by SCAN, the Social Community Activities Network, New Jersey's premier provider of continuing education for adults since 1988.
Hello, my name is Pat Bohse and welcome to Community Connections. Our first guest for today is Kelly Molnar, the Outreach Representative for CapTel Captioned Telephones, who will be talking about how this service can help people with hearing loss who may have trouble using normal telephones. Welcome.
Thank you so much, Pat.
I'm really excited. This is a new conversation for me to have, but I do think when we talk about community connections, this particular show, this is just such an appropriate conversation because for people to stay connected, they have to have devices that they can use. And I have seen you at many of our different events throughout the county, and you have been telling everyone in the world about your particular product. But I really want to know, so what is this caption telephone device?
Well, thank you for having me. This captioned telephone is just a phone like any traditional phone, except it has, as you can see here, the addition of the screen, which allows people with hearing loss to read a conversation.
And so just explain to it a little more. So if someone is talking on the other side, it is translating what they're saying?
Absolutely. It works using voice recognition technology along with a live operator to provide the captions or words on the screen. But then the person is also able to listen to what they're able to hear. So they have the benefit of listening and using the phone just like a traditional phone, but then they also have the words in
so
case.
It's visual.
Correct.
Perfect.
Correct.
And so who is this particular service meant for, and how long have you been doing this? And just tell us a whole bunch of stuff about the company and the service that you provide.
Well, the company, CapTel, has been providing captioned telephones for people for over 10 years. And of course, they've evolved over that time. As technology evolves, they evolve along with it. And I have been with OEI, which represents the CapTel phones, for just over a year. And it's an amazing benefit for people because, like I said, it's just like a traditional phone, but yet it has so many other features, and there are different models. Like I said, as the technology evolved, they created different models of phones to meet people's needs. But one of the core things that they all have in common is an answering machine, because people with hearing loss, it's very hard to discern those messages sometimes, so they're able to read the messages. All the phones also have 24-hour access to customer service with one touch of a button, so if they have questions or need help with the phone. And they also have the ability to make the words that you see on the screen bigger, the captions, so to adjust for a person's vision. And the handset is also amplified so that it's louder than what a typical standard phone sounds like. And they are made in the USA, right here in Wisconsin.
Wow.
And they are meant for anybody we know. We can all think of, I'm sure everybody can think of one person they know who has trouble hearing on the phone. And that person could be, could even have hearing aids, because hearing aids don't always cover every aspect of hearing loss. Sometimes people still have trouble discerning what's being said. So that's where the captions are so helpful, because they're able to distinguish the conversation. And also, we tend to think, that hearing loss only affects one certain segment of the population. But this phone is actually, hearing loss affects people of all ages. And I've had clients as young as 7 years old.
Wow.
I've had clients as old as 101 benefit from the phone. So it's really for anybody with hearing loss.
So again, it works in regards to a combination of visual and then also listening.
Correct.
And then there's also an operator available. Can you explain a little more about that?
Oh, sure. The operator is actually just there to assist the technology, the voice recognition technology. So the operator will provide any corrections that may need to be made. So the operator's actually just listening to what the caller is saying. So for instance, if I'm using this phone and you call me, everything you say to me is going through that voice recognition technology, but that operator is monitoring for accuracy. So that's really the key point.
So if I wanted to use the phone, I would be picking up the receiver and then dialing a number and just talking.
Correct.
And then whoever I'm calling, who I'm assuming does not have hearing loss but might, so this might be a phone to phone at some point in time in regards to both people. But in the same token, if you're calling me and I have hearing loss, how will I know that the phone is ringing, number one? And number two, when I pick it up, what happens?
Great question. So how you'll know the phone is ringing, there are different ringtones available on the phone. So that can be adjusted for a person's level of hearing. But we also have adapters available as well that can flash to alert the person that the phone is ringing. And I'm sorry, the second part of your question was?
No, basically then if I'm calling in, if I'm making the phone call to someone who has hearing loss, you're explaining that the phone would light up basically, that there's someone on the other phone, the other side. And then when I would pick it up, the person who would be speaking to me, that's what we would see in regards to what's on the screen.
Correct, exactly. So if you call me and I'm using the phone, I would be listening and hearing what I'm able to hear, but then I'm also able to read what I'm not able to. So I have the combination. I can listen and also read to fill in that gap of what I'm not able to hear.
So that makes sense to me. So how does one get the service? How do they become eligible?
Okay, the service is actually, there's two components. There's the service component and the phone component. So the phone is actually free with a doctor's certification of hearing loss. And it's like, well, what is that? And it's actually very easy. It's one-page form that a person with hearing loss would take to their doctor or their hearing health professional just to verify that, yes, they have a hearing loss, that they could benefit from using this phone.
Okay.
And the second part is the service. You mentioned that about, well, how does one get the service? The service is also free. Oftentimes people will say, well, what is this going to cost every month? Because we think phones, we think a monthly service fee. And the great part is that it is funded through federal funding, through the America with Disabilities Act, so that funding pays for the captioning service. So therefore the service is also free. The phone is free and the service is free for people who qualify for the phone due to their hearing loss.
So if I wanted a phone and I have to go through this process, how long does it usually take? A month?
Oh, less than that.
Okay.
Once the form is completed and sent in, it's usually within a week or 2 weeks at the most.
And so so now I have this wonderful phone. It's in my house. Do I hook it up to a regular phone line?
Oh, I love this. So it all depends because, again, there are different models of phones. So not to get too technical, but yes, it can hook up to your regular phone line. It does require an analog line or the newer digital lines that people have. But again, we could help find the appropriate home for the correct environment. And along with that is a person does not have to worry about that because we offer free installation. So we can actually, myself or one of my colleagues, go to the home and bring the phone with us and set it up, install it, and then educate the person on all the features and how to use it. So it's not like it gets shipped to their door and then it's good luck with it, unless they want to. They have the option to self-install it as well. Some people choose that.
So I'm watching this TV show and I'm jumping up and down in my seat because this might be what I've been looking for, especially if I'm experiencing hearing loss. How do they get in touch with you?
They can call me direct, Kelly Molnar, at 732-552-6869. We also have an email, a web address at www.oeius.org.
Okay, and on the website, is the other models there for them to look at?
Yes, it is, absolutely.
So what would be the difference? I know that we don't have them here, but what are some of the differences in the other models?
One basically is exactly the same as this model here. It just has a bigger screen.
Okay.
So that usually is recommended for people who have visual challenges along with their hearing loss, because the words are bigger for them to see. And we have another model that is a touch screen. So people who are familiar and comfortable using tablets and smartphones and like that technology, they have that option to use that phone as well, where this is more traditional phone that most people are accustomed to using.
So could a family member who saw this information or saw you at one of the trade shows that you go to make the recommendation, or does the person have to personally agree that they need it, want it, and will use it?
Oh no, family members definitely benefit from. They're our biggest advocates. You know, I always see people out in the community, and a lot of times, because it benefits them as well, a lot of times people will come up and they see the phone and they say, oh my gosh, this would be great for my mom, my dad, my sister, my brother, because they can't hear and I have to drive to their house every time I want to check on them or tell them something important. So this would be so great for both of us. The other thing is, you know, in today's day and age, a lot of times family members will say, oh my gosh, I haven't been able to speak to my sister in so long. If she had this phone, I could connect with her again because she lives out of state. So it's an amazing, as you mentioned in the beginning, it's all about that, about keeping people connected not only to their family and friends, but also to their independence and their ability not to have to rely on others to be their ears.
And is the phone and the service available nationwide?
It is, yes, thank you. I almost forgot that. It is available nationwide. Of course, yes, in the U.S., yes. Okay.
So we have a couple more seconds, so tell us one more time how we can get in touch with you.
Sure. Kelly Molnar. My phone number is 732-552-6869.
And the website?
www.oeius.org.
And they can get all of the information they need there in regards to phones and how to get in touch with you and other people if they're not in this geographic location.
Absolutely.
So I want to thank you for bringing this to us, and it's another tool to keep our community connected, and that's what we're here to do. That's the business that we're in. So I appreciate you coming to share that with us. We're going to take a short break, and we'll return after this important announcement. Thank you very much.
Thank you.
Now's a great time to make your home more energy efficient, and the New Jersey Natural Gas Save Green project is here to help. Take advantage of rebates and incentives up to $19,000 designed to make your whole house more comfortable, improve performance, and save you money. Upgrade your older, inefficient heating equipment, central air conditioning system, and water heater with money-saving, high-efficiency equipment. But don't stop there. Your new equipment will have to work harder, wasting energy dollars if your home is not properly weatherized by reducing air and duct leaks and installing proper insulation. Call the Save Green Project at 877-455-NJNG or visit SaveGreenProject.com, and we'll help you get on the road to energy efficiency and savings, and explain how you may qualify for up to $19,000 in rebates and incentives. Call Save Green at 877-455-NJNG.
Hello again. My name is Pat Bohse, and with us now on Community Connection is Dr. Robert Closkey from Ocean Orthopedic Associates, who will be discussing some treatment options for hip and knee pain, including joint replacement. And I think that this is the best show to do that, because when we talk about community connections, what you do and the services you provide keep people in the community versus in many cases have to be institutionalized. So welcome.
Well, thank you very much. Thanks
I'm
for having
really
me here.
happy to have you with us. So before we get into all of the technical stuff of what you do, tell me a little bit about your specialty and how do you come to our table today?
Okay. Well, Pat, I'm an orthopedic surgeon down Toms River, New Jersey, and my training began. I started out as an engineer. Went to college at the University of Vermont, where I was a mechanical engineering major, and did research up there in biomechanics, which is a field where you kind of combine engineering with medicine. After that, I left Vermont and went to the University of Michigan, where I did a master's in mechanical engineering and then transitioned further towards bioengineering by doing a master's in that.
Wow.
And during that, that's when I decided that what I really wanted to do instead of being an engineer in the lab was to be a surgeon helping people out. And so then I finished Michigan, came back to New Jersey, went to Robert Wood Johnson Medical School, where I did my medical school as well as my residency. And then I did a fellowship which specializes in a particular area of orthopedics in New York City at the Hospital for Special Surgery in hip and knee joint reconstruction.
So again, your background in regards to engineering probably is very well used in the stuff that you do, because a lot of the motion and movement in the joints and hips are not necessarily comparable, but kind of in the same rhythm.
It definitely works very well with orthopedics and engineering.
Yeah. So some common causes, I mean, I do know that, I mean, we've been talking about our baby boom population, and that every day 10,000 people become 65,
Yes.
and we'll continue to do that for the next 20 years. Well, I love that option because I don't think that I would like the alternative. Right. It really kind of opens up this Pandora's box about people taking better care of themselves and better health, and investing in, you know, staying healthy. But every now and then, as we age, our body starts to tell us that it's been around for a long period of time. So tell us a little bit about common causes for hip and knee pain.
Well, majority of hip and knee pain as we get older becomes an arthritic condition, which is just a natural wearing down of the cartilage. The analogy that I use in my office is I tell patients it's similar to the tread on your tire. It wears with use. And what you had mentioned is the increase in our older population, and especially trying to be active. We're now trying to promote keeping that activity at the highest level possible, and that often means going to joint replacements sooner than we used to, because the longevity of the joint replacements is much greater than it was 30 years ago.
So what does that mean, the longevity of the replacement?
When we do a joint replacement, that's an artificial part. It can't heal itself. So it may have a finite lifespan, like being stable in the body. So when we put an implant in, that implant needs to be a solid fixation throughout the life of the implant. And if that implant only lasts 10 years, then you would need to have another one changed. And that's not such a great thing if it's your hip or your knee.
Sure.
So we've gotten joint replacements now that are lasting well over 30 years.
Wow, that's great. I mean, I never thought about it in that respect as far as having to have longevity, but what we're seeing is people are living to their 80s and 90s and hundreds right now. And so to go through that, plus as they age, it probably becomes a lot more serious when you do some of those kinds of replacements. But so if I'm a healthy individual, what should I be hoping not to do in regards to aggravating the situation where I would need a replacement before we get into all of the options available to us?
Sure. Well, the joint replacement is the last step we take. So early on, obviously you want to maintain a nice, reasonable activity level, working on both exercise as well as a healthy diet, and weight loss and exercise are two of the biggest things to take the loads off your joints. And then once you start getting into some early stages of arthritis, you can take over-the-counter anti-inflammatories. And if it gets more involved than what you can take care of yourself with just rest and over-the-counter medications, then us orthopedists are here to help you out. And there's a lot of treatments other than joint replacements that can help keep people going.
So the things that you just described, is that considered conservative treatment, or is there other options there?
Yeah, that is the conservative treatments are kind of lumped together with the non-operative treatments. So if somebody comes in with a knee pain that has a swollen knee, maybe this is the first time that they've had a little bout of arthritis. They have X-rays which show some of the wear, but not enough wear that it would hinder the joint continuing to work well. If it wasn't inflamed, that person can get a cortisone shot to their knee, and that may be something that can hold them for a year or two.
Mm-hmm. And so that's usually the first options before
Exactly.
someone goes to surgery.
Correct.
So Visio supplements, new word for me.
Okay.
Tell me what that is.
So the term is viscosupplementation, which is the second type of injection. There's an injection, the cortisone or the steroid injection is purely an anti-inflammatory. The viscosupplementation, it supplements the normal body fluid. So when a joint is inflamed, the normal fluid in there becomes increased, but it's depleted of its proteins. And the viscosupplementation replenishes those proteins, as well as providing a lubricating surface for the joint, as well as a mild anti-inflammatory. And that's a treatment that can be administered every 6 months.
And is that new, fairly new? Has that been a treatment around for a while?
That's been a treatment that's been around for a while. What has changed over the past few years is the ways it's administered.
Okay.
Typically, it had been administered in a series of 3 to 5 shots once a week, which is a lot of injections for a patient. And now they've been able to improve their the recipe, so to speak, of the injection, so it's a single shot, which people really prefer that over coming for 3 weeks for an injection.
So again, coming back to the whole being conservative, knowing that I need to probably stay active, lose weight so that my joints don't get abused. I need to practice what I'm hearing. And then going through whether it's conservative with shots and supplements, and if it doesn't work, there's some surgical options. And I think that's the most exciting piece that we've been talking about, you and I, in regards to how that's changed.
Yes. The changes over the years have been going from larger incisions to smaller incisions. They're going from, and the term that they've used recently has been minimally invasive. And now we're also, we've moved that from the knee. We've gone from incisions that have been up to 10 inches long to incisions that are about 4 inches. So a lot less soft tissue is being injured during the surgery and needing to be repaired and healing. And then on the hip side of it, we've also now been able to move to, I've been doing an anterior approach to the hip. Traditionally, a posterior hip is a procedure where the patient's positioned on their side with the affected side up. With the anterior approach, the patient is positioned on their back, and the landmark for the surgery is right off of your hip bone there. The advantage with doing this surgery is there's no muscles cut, and the muscles are moved aside.
Now, I know that you brought some stuff to show us. What are those, and how do they work?
Well, these I brought in 2 different hip replacements. The first one I'm going to show is the long stem, which was on for the traditional old incision. So you needed to make a big incision to get a large implant like this into the patient.
Okay.
With the improvement in technology, they have been able to shorten the stem, make it smaller so they can get in through the front, which previously wasn't available. The incision and the approach has been something that's been well established. However, getting the implant in was something that they had not had implants to be able to go in through that approach. So now that that's available, we are able to come through the front of the hip without violating the muscles. The advantage of that place for the patients, you get the same long-term effect and benefit of the hip replacement, which is about 30 to 40 years of longevity. And with that, instead of needing 4 to 6, 8 to even 10 weeks to recover. People recovered up and walking at 2 weeks.
Yeah, I know a few people, again, years ago who had a hip replacement, and I have to tell you, I think that this one gentleman was in the hospital for weeks and weeks and weeks because he got an infection and all of that other stuff happened. And then most recently, another friend had surgery, and up and moving around within 3 or 4 weeks was amazing. I mean, just to see the difference. So that's really exciting. And I think that I would like a piece of hardware in me versus the bigger one.
That's right.
And it seems to be a lot more flexible. So what are some of the, again, situations that some of your patients bring to you? Is this the surgery of last resort, or do they really want to get it done and over with so that they can get on with it?
People come with varying expectations. Some people come in knowing that they have a hip problem. They've seen other doctors, and they come in saying, I'm ready for a hip replacement. Mm-hmm. I want it done anteriorly, so I've come to you because I know that you do that. I've been told by a friend. Other people come in not even knowing what's wrong with them. And then when they're told they have bad hip arthritis, they ask, is there any other alternative to a joint replacement? Joints can always have a cortisone injection, and that can usually give them some temporary relief of the pain. And it becomes up to the patient, where are they at and what kind of treatment are they looking for.
So in your practice, which is in Ocean County, you are part of you have other associates. So basically, what other kinds of treatments do they cover, or do you provide?
Yeah, we're a practice of 9 surgeons. We have two surgeons that specialize in spine surgery. We have 2 fellowship trained in sports medicine. Mm-hmm. We have, and the rest, others are general surgeons, and then myself, who's specially trained in joint replacements.
And so I have great respect for you and your profession, like I shared with you. On my 50th birthday, my husband fell off a 12-foot ladder, broke his tibia and fibia, and was laid up for a year. So we went to see his orthopedic surgeon and doctor a lot.
Got to know him well.
Very well. So, but it's amazing the work that you all do, because, again, you put us back together. So I do appreciate that. So if someone wanted to get in touch with you, how could they get in touch with you?
Well, the easiest way is to call our office. We're down in Toms River on Lakehurst Road, and the phone number there is 732-349-8454.
And again, in the past, you and your associates have been wonderful supporters of SCAN, and we do appreciate that. And the good news is that we're coming to Ocean County in bigger droves next year, so we're hoping to work closer with you.
Well, great.
So really, I'd like to take this opportunity to thank you and to thank our viewers for tuning in, and I wish you much luck, and I know that you'll be bringing fabulous service to all of the people that you service in the future. And again, thank you. So I would like to take this opportunity to say thank you to our audience for tuning in, and for all of our guests, especially Dr. Robert Closkey from the Ocean Orthopedic Associates in Ocean County. Thank you, and have a great day.